My first vaginal breech birth was 14 years ago and was in Africa, in Burundi. Soon after my graduation, midwifery graduation, there was an opportunity for me to live and work in a maternity unit in Burundi. And so I did. I really wanted to learn and travel the world and learn from women, families, other colleagues. And so I did. I left, and initially I was planning to stay there for 3-4 months. And then I actually stayed there for almost 1 year. So my first vaginal breech birth was a surprise. So when I was studying at university, they were always telling us, hands off, you don't have to do anything, which is not wrong. But what they meant was that a woman needs to go through C-section, elective C-section, when we have a breech presentation. And so this is what I've learned. I learned hands off. You don't have to do anything. If you need to do some maneuvers, call the doctor. Otherwise, elective C-section. And when I arrived in Burundi, I remember that day. It was full. It was very busy in the maternity unit. All rooms were busy. All midwives were busy. And so I've seen arriving in the corridor this woman, very young woman, and so I offer her, rather to be in the corridor, just to go in the examination room. It was the only room available. And she spontaneously entered and lie in the bed, and I could see that she was in advanced labor, and she started pushing her baby out, and I went there to support her, and she removed her clothes, and the baby was breech. So I could see the legs, and I could see the feet, and I could see the bottom of the baby. And so I was like, wow, never seen that in my university, and I was fresh graduated. And so what I knew was just seeing the pictures from a book. There was a colleague of mine there who was scared, who never had experience with breech birth, and so she told me, "Yeah, just go, you go. I'm scared. I don't want to do anything. I can't do anything." And so I went there just to support the woman. Not that I didn't even know what to do. And the woman gave birth beautifully. The baby was perfect, was so pink. I still remember. Cried immediately, and she did skin to skin. Everything was brilliant, perfect. That was my first imprint of a breech birth. And so after that, I was curious, because for me there was so much controversy and different experience and different I would say thoughts about breech birth. And so I've started reading about it, learning more about it, asking more, and eventually assisting more women there in Burundi. And then I worked more in Africa, so my experience kept growing. Eventually, then when I went to Afghanistan, where we were assisting to more than 20,000 women per year, so I've seen a lot of breech birth there. And what is different, why and other people, and midwives, doctors who go and work in Africa have a lot of experience with breech birth. It's because not because we want to experiment on women, but it's because of the context. And in those contexts where there is no infrastructures, health system are limited. There are not much resources for women to have a scar and to have a surgery and to have a C-section. It's really a big deal. And so before calling for a C-section in those contexts, you really need to have a good reason. And breech birth, and this is to say the breech birth is not really a good reason. It is really important that women who wants to go through labor, that experience labor for many reasons, that I'm sure you know, experiencing labor, the hormones, and the gradual development of the baby, even lungs, respiration, it's so important. And the exposure to oxytocin, endorphins for the baby, the imprint. So it's so important, even if you choose to go into spontaneous labor and you might want a C-section later. But the fact that you go in labor is such an important event for you as a woman and for the baby. So that's why going straight to C-section, I believe it's a big deal, not only for the context I describe in Africa and Afghanistan, but for all women. I witness many times in hospital setting, when I was passing by or when I was doing an extra shift, women coming and undiagnosed breech, because it happens that baby turned or during palpation, sometimes it can happen. We are not God, so it's normal that there are some babies who are undiagnosed breech and come to the hospital and surprised there is a breech. And so those times, rather than giving options, and it can be tricky to discuss options during labor, but I've seen many doctors playing the card, the vulnerability card, and say your baby is going to die, so let's go for C-section. And when actually there was a really amazing progress and the labor was going so beautifully, and so I witness for women being vulnerable in labor and the doctor saying your baby is going to die, that's actually a really manipulative game. And so of course they go for C-section, they want their baby safe. And maybe in labor is not the best time to discuss things. And yeah, so I witness also fear taking over, which is, witnessing a labor going beautifully and then arriving to the hospital and interfering with that process. Yeah, so I have different experience with breech that varies, and I also supported women actually going into labor at home and progressing spontaneously, and then they didn't feel to stay home and they went to hospital, and that really depends on the hospital where you go. Some hospitals, some doctors and midwives are open and they leave you laboring and going through the birth process. Some others are very scared and they push you for C-section. First of all, I have my helper here, and this is a doll, just to start from scratch and explain to you what's a breech presentation, what's happening when the baby is in breech presentation. And so this means that is when the baby presents the birth canal with heads up and bottom down. So what we see through the birth canal, it might be the feet, it might be the legs, the feet, and the bottom. It might be just the bottom. So, and not the head. The head is up. Normally the head is down, but with breech is heads up and bottom down. And I want to say this is not a pathology. This is just a variation, and there are so many reasons why the baby head is up and not down. It might be for, shape related to the womb. It might be some ligaments and muscles tensing up and not allowing the baby and the womb to have that mobility that we want to see. It might be for emotional reasons. I would say this knowledge that passed to us, at least it was passed to me by other colleagues and by other more experienced midwives, that when the baby is breech, there is something that the mother and the couples and the baby as well are undecided about something, and so the baby change position. This might not be necessarily true for you, but this is also, I want to share with you what has been passed to me. So now that I'm saying it's not a pathology, it's just a variation, why are we so scared? Why are we so scared to when the baby is on breech presentation? There are different reasons. I just want to give this background that many years ago, many years, hundreds years ago, women were giving birth vaginally to a baby in breech presentation, and it still, as I said before, in some context is the case. And now this is disappearing. But why? Because there have been some studies that have influenced protocol and practices amongst hospitals and midwifery colleagues, midwives, doctors. And so these skills are lost. There are probably few people in the world who are skilled, who have seen or witnessed breech birth. And there are also many women that choose to give birth at home with no medical assistant. And that's, and this is what I want to share with you all, that regardless of protocols and guidelines, it's so important to actually know all the options available. Maybe investigate a little bit on if you want to know about studies and research, and then choose from there. There is no right or wrong from giving a birth at home with no medical assistance to doing an elective C-section. It's just really knowing the options, because I witnessed many women who the doctor planned an elective C-section at very early with no explanation, just saying elective C-section, that's all. But it's really important to know, maybe understanding, maybe there is also a reason why your baby's in breech presentation, and you might want to dig and explore a little bit why. When they say it's C-section, that's all, that is an indication of the doctor or the midwife don't have any experience whatsoever. Otherwise, they would counsel you and they would share with you all the information and actually give you options. So when if this happens to you, maybe you have an option to contact someone who has experience, and so that you really use few hours to really dig into so many materials. You can also do your own research and see what's resonate for you the most. There was a study called TBT, Term Breech Trial, in 2000, which influenced many protocols and practices and guidelines. This study was not done very well, and after a few years, actually, the author published notes explaining that we shouldn't take into account this study. The study was saying that actually doing elective C-section for breech is safer than a vagina breech birth. The fear, why do we have, not me, but why other colleagues have so much fear? It's because so when the baby, when in labor, and when there is a fully dilation, the baby starts advancing and dropping and passing through the birth canal. So of course the legs and the bottom and the body pass first. So we have the cord still attached to the placenta. So all these parts come first, and they are soft, and so usually they don't. There are no many problems with this part. But when we start going up, there is more bones. So we have the shoulders and we have the head. So the fear is that actually the head gets stuck. And so there is really, I would say, an urgency to intervene so that the head is unstuck, unblocked, and they can, and the baby can come out safely. But I would say, especially for the first birth, this needs take time, and so the baby might not come up with one push, one contraction. It needs time to come out, and when it takes time, it doesn't mean that the baby is going to suffer. Yes, the cord is compressed. But I've seen many baby that take some time, and when they come up, yes, they need a little bit of more time to transition to earth and breathe, but they don't have any major complication. And actually there is a study that was published that they compared after 2 years from the vaginal breech birth. They compared, and I think vaginal breech birth with elective C-section for breech birth, and they've seen that there is no brain damage or consequences from the birth after 2 years. And so this means that baby have resilience, and actually, even though it's a bit slow, the transition from the womb to the earth, and baby takes time to breathe, that actually there are no major complications and the baby are safe. It's just to give some time. Then of course, if it takes a long time, there are some maneuvers that can be done together with movement and following the intuition of the mother's and women's body. And also, when these maneuvers need to be done, if there is a need to be done to do this maneuver, it's important that the women are counseled and informed before. So in my consultation, we watch movies, and I explain movies of some videos of breech birth, and I explain all the mechanism, and I explain when the maneuvers are needed, because most of the time baby comes spontaneously and there is no need to do anything. And that's right, hands off. That's totally right, hands off. And it's just to give the opportunity to women to follow the intuition, follow the body. And if they want to move or they want to lie down, this is the same for cephalic presentation. There is also an option to do the external maneuver if the woman wants, and works 50-50. For some women it's very painful, so women want to avoid and just leave the baby be in the position that the baby wants. And what else? Eventually is your choice. And I think it's very important to discuss everything with the couple, with the woman, and really choose what's best for you. and even go through, if the woman wants, the studies that are available. The experience of other women is so important, and also when is the actual need to do the maneuvers, because I have colleagues who have done PhD, who have done study research about it, but they intervene after a contraction. They intervene and they want to help the baby to avoid any complication, but actually it might be too soon. Most of the babies needs more time, and there are some signs to look, like the color of the baby, the cord. When the body's out, we can see part of the cord, and if the cord is still pulsating, is still red, there is still a lot of blood, that is a good sign, and means that there are still blood and fluid and oxygen going to the baby. So maybe we can wait a little bit longer. But if the cord is white, and this means that there is not much blood coming to the baby, maybe that's the case to intervene and do some maneuvers, or maybe the mother or the father want to help, want to put the hands in their baby, and not the midwife and the doctor. Also, when I was in the UK, I had experience with many women with their baby in breech presentation. I had a beautiful birth in the birth center, led by midwives and the woman, of course, and it was the third baby, so it was quite straightforward. I had other women who went through a 24 labor, and there were no progress. This is another thing that I've learned, is that what I told you at the beginning, hands off, it's true, because when the breech birth is progressing well, actually you can see a kind of straightforward progression, and you don't need to put your hands anywhere. It's actually a very straightforward progress and gradual, where meconium, so the fluid becoming brownish, it's normal, it's completely normal, because especially when the baby is advancing in the birth canal, the stomach is squeezed, the bowels, so baby release his or her first poo, so it's quite normal. I would say many professional, if you choose to give birth in the hospital, many professional tend again to intervene, and for example rupturing the membranes or other things can cause more complication, and can cause to slow down. So the beautiful birth I assisted were women mainly progressing in labor by themselves and arriving at the hospital ready for the baby to come out, to be born. So and that is a good, amazing sign, and nobody should do anything, just witnessing the birth. Another controversy that I always had doubt as a fresh graduated midwife was episiotomy, because in the way I've learned, doctors was always telling us to do an episiotomy, and probably I did it the first time, the first breech, not the first absolute first breech, but the first 10 breech that I witnessed and assisted, maybe I've done it once or twice. And not because there was a big need, but because of fear. And this is what I want to share with you, that many things are done because of fear, even elective C-section, and not because there is a real reason. So this is why I'm saying that it's so important to discuss everything, every little details with the woman, and ask her what she prefers for her birth. If there is a need to do maneuvers, I just want to explain a little bit the mechanic and not overcomplicate it. So when the baby head is down, there are pressure on, the contraction, the waves, the muscles, and everything gives pressure to the baby to flex his or her head, and to advance to the birth canal. Even the baby has his own intelligence to do that, because babies, newborns have reflexes that are really important when they pass through the birth canal, and allows them to do to flex the head, to push with the legs on the fundus so that they can advance through the birth canal. When the baby is breech, so the opposite, there is the same pressure that I was talking about, but there might be something going on in the arms and in the head. So the biggest diameters of the baby are the hip, the shoulder, and the head. So once the hip and the shoulders are passed by through the birth canal, we know that the birth is possible. But there might be some signs when the baby descends. Usually it descends straight, and there might be in some occasion where the baby start to do some weird rotation, and that might be a sign that the arms might be up and actually hanged on the hip, or even the head. It might not be flexed how we want it, but it might be extended, and so it can hook on the hip. And so that might be a reason to actually intervene and help the baby rotate it. But how can we do it in a gentle way without, putting the hands up? The best way, I'm sure, I know, I've seen it, women changing position and adapting different positions so that they can widen their hips, and then usually actually help. So one thing that if you witness a birth as a birth keeper, a midwife, or doctor, is actually follow the mother's intuition, but also asking how can we make space for the hip in case the baby need to do some movement to change his mechanic and diameters and position. And then it's completely possible doing it. And so widening the outlet of the pelvis, it's a really a big solution and a big tips for the woman that can help her to unstuck all these issues if we have. And there are some maneuvers which are helping the arm to get unlocked, or helping the baby to flex the head. But the best way without interfering too much is really asking the woman or inviting the woman to shake her hips or to change position. But I believe honestly that this is something a woman who is connected with her body, that she will eventually do herself. There are many hospitals and professionals around the world, not many, but few more than years before that offer support, and few professionals that have more experience because they've started actually supporting women with breech presentation. Also, some guidelines have changed. The Royal College of Gynecologists and Obstetricians in the UK have changed the guidelines a few years ago, and so there is, and they offer for women to go for spontaneous labor rather than elective C-section. And I also want to add, meanwhile, the storm came and my grandmother is cooking, but I want to add that having someone who is skilled does not mean safety. Because safety comes from you, from your intuition, from your body, inner capacity to give birth. So some skilled professionals tend to jump on you to really intervene, and that is an interference on the birth process. Even if the baby is in a breech presentation, that does not change comparing to cephalic. So be mindful of on what you want to choose for you for your birth, and yes, and even if you go to the hospital and you find someone who supports you, but I believe that it's a process, always asking you what it's best for you, always asking you permission if when you want to do the maneuver, if you want to do the maneuvers. That's really important. So skilled professionals does not mean absolute truth. You can also try different things if it's something that you want to do, like the moxa, which is a traditional Chinese medicine way to stimulate the uterus and increase the mobility for the baby to turn. There are rebozo, spinning baby, position yoga, but I would suggest with no pressure, do what you like with no pressure at all. I feel in my experience the best way is really to connect with your baby and to not to forget that the best thing is always be connected inside and see what's the best way for you. There are also traditional midwifery ancient technique to turn the baby externally, so there are options, but there are probably a lot of pressure sometimes on doing things when the best thing is actually to be still and close your eyes and spend few moments just to connect within you, because the answers are always within you. And if you choose to birth with no medical assistance, that is also possible. And there are so many resources if you want to investigate and learn more about your baby presentation and the mechanism to go through the birth canal. And also if you need to support your baby, how you can support. So please reach out, share your experience, comment. If you need support, I'm here. You have all my links, you have all my email, Instagram handle, and you can contact me to share your experience, also to share what worked for you, what's working for you, what did not work. Let's share more. Let's have more choices available for women, because as I said, there is no wrong or right. It's your experience, it's your choice.